Dear listeners, welcome to Faces of Digital Health, a podcast about digital health and how healthcare systems adopt technologies. I am your host, Tjasa Zajc, and this is the second part of a short series about digital health in Asia, through which I am presenting digital health adoption in China, India, Singapore, and South Korea. In the previous episode, you could listen about the general overview of the region with Julian Celeberry, CEO and founder of Gannon Growth Asia. And today, you will be listening about China. China's population is larger than the population of the US and Europe combined. China is becoming the leader in AI development. The enabling factor for China's rapid advancement in AI is that the Chinese tech giants and government agencies are investing heavily in the most important field for AI development, data infrastructures. In healthcare, for example, the company called Yitu has a team of about 400 doctors, most of whom work part-time for about 10 hours a week to help label data. 1/5 of the healthcare team's full-time employees have a medical background. According to Philips Future Health Index 2019, China is also an outlier in terms of healthcare professionals encouraging their patients to track healthcare data. With the rapid pace of development, all eyes from the West are on China. In his book, AI Superpowers, Kai-Fu Lee describes Chinese entrepreneurs as gladiators, willing to do anything for the financial and market success of their companies. I was wondering, what are the cultural differences of Chinese compared to the Western entrepreneurs? Why is copying so culturally acceptable? And do we have a reason to be afraid of the intimidating speed of innovation in China? You will hear from Julie Wang. Julie is the VP of Customer Success at Linked Care, a leading digital platform in Asia offering a range of diverse products and services, including cloud-based electronic health records platform, clinics management system, and supply chain management solutions. Enjoy the discussion and do subscribe to the podcast to be notified when the next episodes about India, Singapore, and South Korea are going to come out. Julie, hi. I wanted to start with a little bit more of a broad question, and that is, what is the relation between the Western and the Chinese medicine, and how does that fit into digital health? How do these three things intertwine?
My observation of digital health in China is that it's definitely a very quickly evolving field. In particular, because of the rapid adoption of mobile phones and a lot more digital technology in China. So, and comparing it with other Western countries, I think it is definitely being adopted at a higher rate in the healthcare field. But of course, I think because the level of the health service is comparatively lower than the Western countries that I've been and observed. So I think it's catching up in healthcare services in general, but also being powered by a faster adoption rate of digital technology in China.
A lot of experts about the Chinese market emphasize that Chinese consumers differ a lot from the Western consumers. What's your observation? You already mentioned that the uptake of mobile services is different than from the West.
I think if you see the success of Didi compared with failure of Uber in China, you see that the Chinese market are behaving differently with Western markets, and especially with regards to how users use digital technology overall. I would say consumers in China are more open to new technology solutions. For example, if you see how the younger generation are using WeChat. They're basically using WeChat for all kinds of purposes, including shopping, bank transfer, and even a lot more recently, paying their utility bills, and a lot of other related activities on WeChat. And with the rapid expansion of WeChat's mini programs, a lot more can be achieved actually on the WeChat platform. So I think it's a combination of how the mobile giants are evolving in the market, and also I think the market, especially the younger generation, are more open to adopting newer and faster and more convenient ways of doing things. I lived in Silicon Valley as well, so I know that compared with the Chinese markets, the younger generation, U.S. consumers and a lot more European consumers are not as open as Chinese consumers, especially with regards to things that are privacy related and data related.
It's a little bit hard to imagine what are the basic values of consumers in China. The Future Health Index report by Philips, for example, says that the Chinese doctors are an outliers in the sense that they encourage Chinese to record a lot of data about themselves, to track their health, and the consumers there are open to do that as well. And even if you look at the development of surveillance technologies and how AI is developing in China due to the rapid increase in data gathering, it seems that the Chinese consumers are very open to gathering data and sharing privacy information if it brings convenience.
There's no hard data to actually prove that Chinese consumers are more open and more willing to give up their data privacy for convenience. But I think your observation is probably right in the sense that the Chinese consumers do not talk much about data privacy. It probably does not mean that they don't care internally, deep in their mind. But I think they definitely require a lot more of privacy compared with data privacy. And more specifically in digital health and healthcare, good health service is very rare resource in China because of the population. So if you look at the doctor to population ratio, good quality health service is a very rare resource. So compared with data privacy, people care much more about getting a better quality of health service. So if you imagine consumers purchasing health monitor and trackers, for example, they value the benefits that are brought by the tracker a lot more than they care about their data privacy. So I think it's, again, a result of the population and the current level of our health service in China.
What would you say is the percentage of the population that actually uses digital health solutions? Because China is almost impossible to imagine in terms of size. The sheer number of people exceeds the number of people in Europe and the US combined, and it's kind of hard to grasp that. It's really a huge market. So I'm wondering, how diversified is it?
There are quite a few different sets of numbers that are available in the market assessment right now. There are a couple of numbers I can share that I think are probably reflecting the true behaviors of users. There is one number by BCG calculated back in 2015. The estimate of market size by 2020 back then by BCG was basically 700 billion RMB, which is roughly 100 billion euro or US dollars. So that's actually a very large number. And the other number that was prevalent in the market estimate was the number of users. And back in 2017, the number was already around 150 million users. And by now, I would imagine the number to be around 200 million users. And that's about maybe 15% of our population. But I think that their behavior is definitely very different. So I would imagine a very small percentage of users actually pay with their QR code for health service, and a lot more percentage of users only maybe check for their bookings or appointments at health services. So the user behavior, I think, vary across different cities and different age groups. But the overall number was estimated to be around 200 million people in China.
One thing that is very culturally acceptable in China is copying. Kai-Fu Lee explains in the AI Superpowers book that Chinese don't just make copies of the ideas they see on the West, but copy them in a way that it's hard to compete with the Chinese versions. So, for example, Tuja, the Chinese copy of Airbnb, has local managers taking care of check-ins and check-outs and the authenticity of photos that the lenders want to post on the platform. And further on, what this tells you that the Silicon Valley takes a light approach in their innovation, whereas the Chinese take a heavy approach, meaning that if Google is trying to win the market with one solution with little iterations on different markets, Alibaba and Tencent are investing heavily in local startups. How does that reflect in digital health? What are the solutions? Tencent also is entering healthcare.
Just to start with the copying problem that we've seen in the past and until now, it's still a problem. I think we should face the problem that there is IP theft, and it needs to be addressed gradually and taken seriously by everyone. But I don't agree that copying is very culturally acceptable in China. I would say that Chinese learn very quickly from other people, including business models and how ideas are generated. Gradually, they learn and then they also create their own ideas. For example, previously, as I mentioned, WeChat mini programs are created by the Chinese people for a Chinese market. So I think, copying, as I said, as part of the learning process is very much observed in the Chinese market. But, as time goes by and we learn and evolve, there are new ideas emerging as well. With regards to digital health, I would say a lot of digital health startups tried to copy ideas, business models, and even how things are done from Western countries, including European countries and the US. But things are very different in China, including the entire health system and how it's designed. I think the largest factor in China is the population. So the size of the population basically determined a lot of things cannot be done the same way as in Western countries. So although a lot of people try to learn and to some extent copy from Western countries, I think they need to adapt to the local markets. One specific example that you also mentioned is WeChat Health. WeChat Health right now is given a very high priority by Tencent internally and also highly expected by a lot of external participants and partners. Essentially, they're trying to link up the entire healthcare ecosystem services. One of amazing products they've done recently is to create a mini program that allow patients to basically search for certain disease and learn and educate themselves about the symptoms and how to prevent them in their daily lives. So I think it combines its social media users, a large base of their entire users, and use a very simple way and a very easy learning interface to help their users to become healthier over time. And that is basically not observed in other countries. So I think in terms of how innovations are done, specifically in digital health in China, a lot of the innovations you will observe and already observed are new and novel.
How would you say similar companies to the West compare? So, for example, Illumina and BGI on the genomic side. Can you make any other parallels of Chinese versus Western companies?
because we've been talking about WeChat for quite a bit already. So I'll just start with beyond digital health, WeChat versus Facebook. When WeChat started, a lot of people are criticizing WeChat of basically copying Facebook and Facebook Messenger. But over time, they saw that WeChat is evolving in a completely different manner. So Facebook is creating a more of a public community for people to share and communicate. But WeChat is more of a closed loop of friends. So we know each other on WeChat. Our WeChat friends are actually friends in our daily lives as well. So over time, it evolved in totally different ways and allowed different kinds of possibilities. And digital health more specifically, I would say, your example of BGI versus Illumina is a great example. I think Illumina is more of R&D focused company and invests a large amount of money in R&D and essentially license out their patents globally. BGI, on the other hand, I think it's more of a service-oriented company. It does invest in R&D, but because it serves a large country with a relatively lower level of health services, so its income actually comes a lot more from services and not as much from licensing out their patents. That parallels apply to a lot more other digital health companies as well in China. I think a lot more are service oriented and a lot less investment in R&D. So it's a lot more focused on services and a lot less focused on R&D.
Asian countries are marked by the increase in connectivity and 5G spreading, among other things. What would you say in terms of digital health, all this connectivity is bringing? Is it bringing more convenience to the higher end users so they can access their doctors more conveniently and faster? Or to which extent does it actually increases the accessibility to healthcare professionals? One of the problems that China has is that the distribution of the quality or levels of education doctors have varies a lot. So a lot of consumers tend to migrate towards larger cities where they feel that the care is of higher quality.
It's related to a very hot topic in China in recent years, which is primary care. I think it's definitely is a hot topic globally as well. I think when we talk about primary care, one of the problems in China is, exactly as you mentioned, it's a large country and a lot of people live in rural areas as well as what we call tier 3 and tier 4 and even tier 5 cities, where healthcare resources, including doctors, hospitals, and other related resources are significantly of poor quality compared with tier 1 cities. Overall, I would say because of the ability of people and their education level, right now what we observe is still that digital health is benefiting people who are already in the tier 1 cities. So people who are more educated and know exactly how to make bookings and how to track their health record through digital apps. How to make their insurance claims more efficiently through their insurance apps. And that's not a capability that tier 4 and tier 5 and rural area population are naturally capable of doing. But I think another trend that we see is that a lot more what we think are of higher quality services are expanding into tier 4 and tier 5 and rural areas because of better logistics services and digitalization across China. So I think, currently I do agree that it is benefiting people who are already having better health services, but gradually I think as it expands, more and more people and other areas in China will benefit eventually.
What would you say is the reason that the uptake of digital technologies and smartphones and mobile-first approaches is so successful in China specifically compared to the West? Because, for example, the Western population also uses smartphones, but it's hard to imagine that the Western countries would become cashless economies as the Asian countries are shifting towards.
I think there are two reasons. One is more, as you mentioned in your question, I think more culturally related. The other one is, I think, more related to the era and time we live in. One of the cultural differences my Western friends don't naturally understand is how what we call hardworking the Asians are. They hear a lot of stories about how Asians work very hard and prepare very hard for exams, starting from very early age. I think that's reflecting how competitive the market is and how hardworking they are naturally because of the population. So I think Asians overall, and especially I think Chinese, are very hardworking. So they try very hard to obtain and learn and evolve and adopt new technology. And that's, I think cultural reason behind the rapid adoption of new technology and especially mobile technology. The other reason I think is very important and often discussed is the time we live in, because Asians and the Chinese were already behind in the digitalization process. So when we started digitalization, roughly in I think 1990s and more broadly nationally in 2000s, we are already in the mobile age. So we skipped basically the credit card age and the email age, the desktop age, and directly into mobile age. Mobile phones were replacing paper and letters, debit card, or even cash. That resulted in a faster adoption rate of mobile technology and mobile payment and eventually mobile phones. If you see, how amazing mobile technology and especially I think mobile payment is in China, you will see that even paper stands are using QR code to collect their payments. Before that, they were using cash. But I think compared with Western countries, mobile payments were trying to replace credit card, which are already very efficient and I think very easy to use. So I think there are two reasons. One is Asians, I think, are natural learners who want to obtain faster, more efficient, more advanced technology. And the other one was that we were indeed replacing a more outdated technology of doing things.
It was a good opportunity to leapfrog when new technologies were already available and incumbent systems that are hard to replace weren't in place, I guess. One thing that I thought was an interesting comparison by Kai Fu Lee in the book that I mentioned, AI Superpowers, was that he said that if you compared the Chinese entrepreneurs and the Silicon Valley entrepreneurs, and, for the West, Silicon Valley is a synonym for hardworking innovators driven by their missions to improve the world. But the Chinese competitors are gladiators, so just the word itself tells you that they are a serious competition just from the cultural approach that they have towards business.
Right. I think Chinese are known to be very hardworking and competitive. So I think that's an advantage. But I do believe that as this generation become more mature and our current technology evolves, perception of Chinese to be hardworking will eventually become that Chinese are actually innovative. But it probably take a couple of decades to achieve there.
One area that China is especially strong in is also artificial intelligence. As I mentioned before, the development here is possible because of the rapid increase in data gathering, which is a basic component of AI development. And in the healthcare arena, one AI company that is entering healthcare is Yitu. They also published the first natural language processing in healthcare article in Nature in March. And one thing that I thought was really interesting is that they have a team of 400 doctors, most of whom work part-time for about 10 hours a week to help label the data, while 1/5 of the full-time employees have a medical background. That to me was really interesting because to have good AI algorithms, you also need to have good data sets. And one problem in healthcare is that the data is not standardized. Each clinic or each doctor has his own way of describing things, and we know that interoperability is a huge issue. So Yitu has an interesting approach to tackle that.
Right. I think AI plus healthcare is definitely one of the hottest, if not more, in the recent years. And healthcare, and especially diagnostic area, is one of the most important application areas of AI. That's why Yitu, as you mentioned, and also a lot more technology giants, including Tencent, Alibaba, and Baidu, are investing in this area as well. I think if you look at the adoption rate, a lot of companies' AI plus healthcare services have already gained initial success with regards to their partnerships with hospitals. Those solutions are usually used in helping doctors diagnose very sophisticated cancers and other disease. But still, as I said, those are only in pilot stage. I haven't seen any company in this field achieving success at a national level or expanding very quickly into hospitals. So their solutions are right now still in pilot stage. One of the dilemmas and difficulties across the globe and also in China is, I think, the ethical problem. Whether AI is indeed a legal way of and part of the health service. Can it be used as the way that doctors are in terms of diagnostics and giving prescriptions eventually? So that's one of the difficulties that we also face in China. But because of the population and the data that is available in China, a lot of companies are trying to use their AI technology to do something in healthcare space. Still, I think it's very early stage. Healthcare digitalization is still the main focus of digital health, how to track data, link up doctors, patients, and other partners in the healthcare ecosystem. That is, I think, the main stage. AI plus healthcare, I think, is still very far away and still in pilot stage.
So in practice, if you go to the doctor, how does that look like? Is everything still on paper? How digitized are doctors' offices and hospitals? Do you have to carry your exams with you when transferring from one institution to another?
There are two parts of the entire health system in China. There is the public health system, which takes a significant percentage of the entire health service. There is also private-owned health service that takes a small percentage of the entire health system. So if we talk about the public health system, I would say data is very much fragmented. Again, China is a large country, so if you visit one hospital this time and go to another hospital the other time, likely your past health records are not recorded as sufficiently as you would wish. Very basic information is recorded, but not every piece of your past record is recorded in the public system. In the private space, if you go to a chain clinic, likely your patient record is very sufficiently recorded, but that's based on which clinic chain you visit and what kind of membership you have. I think in the public health system, because it takes a large percentage of the entire health system, the problem is still that public hospitals do not have much incentive to align in terms of what kind of IT system they use, how do they record their patient data, and how to actually share data. That is is a massive project for every country. The good news is a lot more doctors are right now recording actually on computers. 10 years ago or even 5 years ago, a lot of doctors actually, writing on paper. But now it's a hard requirement by the government that they need to actually input data into the system. So I think it's a very gradual process. Right now, we can only count on the data to be electronically recorded. I think if you are looking at how overall the data is transferred across different hospitals, I think it will still take maybe 3 to 5 years, if not more.
Which countries is the company that you're working for currently present?
So the company I recently joined is called Linked Care. It's a SaaS platform that is created for clinics, specifically I think for dental clinics and primary care clinics. It has a couple of target countries, but mostly I think Chinese market, and also Greater China markets. So Korea, Japan, Taiwan, Hong Kong are also our target markets as well.
As a customer relations specialist, would you say that there are any differences among the consumers in the mentioned countries?
I think the major difference across these countries is the level of digitalization and the mindset towards digitalization. I think the Chinese customers that we have are more open to changing their past behaviors. The Hong Kong-based customers and also Korean-based customers that we work with are less open to their digitalization process. So I think it is very similar to what we discussed about the differences between Chinese consumers and Western consumers. That's one of the differences that we've seen.
Do you have any predictions of where the Chinese healthcare is going to be due to all the pilot projects and all the digitization that's rapidly evolving?
I think there are multiple levels of digitalization across countries. So if you look at the highest level of digitalization, I'm sure that you've seen it in the news as well, that we have an entire hospital built based on 5G technology, from patient appointment to doctor's prescription and to when you pick up your medicine, the entire process is very much digitalized and powered by 5G technology. Those are usually solutions built for new hospitals. But if you look at, the bottom group of digitalization, we're still looking at, how do we transform the doctors from writing on paper to actually writing and putting data into the system. I think in 5 years' time, we will see China having probably the most advanced hospitals globally powered by 5G, and everything is digitalized. Every process is digitalized. But I think in 5 years' time, in rural areas, there will be a large percentage of hospitals. We're still working on transforming their user habits. Overall, I'm very optimistic about the digitalization process. I think we'll see mobile appointment, mobile payment, and even mobile health records for a large percentage of Chinese population in 5 years' time. Two extremes remain the same in 5 years as well.
One last question. What would you say the West can learn from the Chinese entrepreneurs when it comes to digital health?
One of the good things that I've seen in the market, and also, me personally learned from our CEO who has more than 20 years of experience in healthcare, is to work with the government. I think Western entrepreneurs, because of their natural, I wouldn't say hostility, but I think they don't naturally think about working with government as one of the necessary steps towards success in this field. But I think if you look at the healthcare industry, government actually plays a very important role, not only the national level, but also, at the local level. Government plays a very important role in the entire industry and how you define your business processes and your go-to-market approach. I think Chinese entrepreneurs in the digital health space are more open to working with governments, and they have more sophisticated strategy of how they actually work with the governments and navigate the difficulties and complexity in the healthcare system. I think that's one of the things the Western entrepreneurs could potentially learn, and don't, from a mindset level, don't avoid working with the government when they think about their strategy and their go-to-market plan.
This was the second part of the short series about digital health in Asia. In the next episode, you will get to know the state of healthcare in India.